Hi, I'm Dolly Basta, and welcome back once again to Dolly's World. I have an old friend here today who has been with us, I'd say in the last few months, and many people came up to me afterwards and said, gee, when will you have him on again? So here he is today, Dr. Mark Newkirk. He is owner-director of Margate Veterinarian Hospital and Alternative Care Center. I didn't believe I would get all that out this time, Mark, but welcome back to the show. It's delightful having you.
Well, thank you.
And last time that you were here, we did this whole thing on nutrition for animals, which is completely different from what most people feel that nutrition for their animals is.
Correct.
Okay, today you suggested that we talk about chiropractic.
Yes.
And it sounds fascinating, and I think from what I have read, so many things that have been tried on animals first really is the beginning to what people are doing themselves. It
Correct.
starts with them.
It generally starts with animals, testing of different modalities, even testing of surgeries and drugs and that kind of a thing. Then it's all developed for the good of the humankind, so to speak, and then eventually things either become cheap enough in the case of drugs or machines like MRIs, etc., that everything filters back to the animals. But techniques such as chiropractic and acupuncture, especially acupuncture back in the Chinese world, was well, it's thousands of years old, and diagrams of the horse and the dog were developed by the Chinese thousands of years ago. So it's a modality that's been around for a long time. A lot of people think it's quote-unquote new, but actually it's one of the oldest forms of medicine around the world.
Well, we have a friend with us today, and hopefully he is going to help us out. It's my duff, and I think he knows you are a veterinarian. I don't know, you must have an aura about you, Mark, but he is running around the studio panting.
He's a little nervous today.
So it's not you, it's not me, those strange sounds are coming from.
It's usually those vet vibes that are out there.
But he should settle down. Okay, so where do you want to start with chiropractic? Does this also apply to cats as well as dogs?
Yes, cats actually respond even faster to their general problems than dogs do. But I got involved with chiropractic because I was going to chiropractor myself, and I know he keeps me walking, and I thought, well, I see so many animals with hip problems, knee problems, back problems, arthritis. Why wouldn't this work? And so I researched and found and trained, and we found a therapy that works very well. And then combined with the nutrition therapies that we talked about last time, and some of the supplementation and pain medicines and acupuncture that we'll talk about today, it's probably the #1 alternative therapy that we do now. It's highly successful. We really have helped a lot of animals. We have a lot of animals now. They're walking much better. They're off their pain medicine. They're on better diets. They're on the supplements that we'll talk about. But it's quite successful in most cases.
But as with adults, it's not an instant cure. It's a process over a number of visits.
Correct. And chiropractic care is not generally a curative. It can be in the case of an acute injury. We'll have some patients that come in, maybe they fell down the stairs, and we'll do a couple or 3 adjustments plus some other medications, and then they're fine. But most of the animals we see are chronic arthritics, or they have hip dysplasia. Once the animal's in that stage, we're not going to cure that problem, but we can certainly mitigate it and make the animals a lot more comfortable doing these alternative therapies and getting the animals up and walking, and preferably off of the steroids and some of the high prescription painkillers that a lot of them are on. There are times they need pain medicine, but in the long term, taking pain medicine or steroids every day, we all know that's not good. So bringing the alternative modalities together, oftentimes we can greatly diminish, if not get them off of the pain medicines.
What other medicines do they give for pain to animals?
Well, now we have a whole range
Really?
of pain medicine. Pain management has become very big in the last few years, and in fact, you'll even see some of these commercials on television now about pain in the animals. But we have, the Rimadyl was probably the first one that came out.
You're kidding.
Now there are multiple brands, and they follow the same pharmacology as human pain medicines and anti-inflammatories. We do use some of the narcotics if they're really bad. Post-operatively, we even use the pain patches that you'll see people wear, and we have those adapted for animals now. So depending on the degree of the animal's pain, we can go from general anti-inflammatories all the way up to narcotics. And then in my practice, we use herbs and we use homeopathy, acupuncture, chiropractic, all different kinds of alternative therapies to help alleviate the pain.
What is the one thing you should never give a dog for pain?
Well, the big problems with the dog seem to be the ibuprofens. It's not that you can't give it once here or there, but chronic use tends to lead to a lot of side effect problems. The other one is aspirin, and aspirin can go into dogs for quite a while without causing problems, but it does have problems with the bleeding times. We'll see GI ulcerations, and we'll see the lack of clotting factors from long-term aspirin therapy. So an aspirin here and there for a dog is not bad. An aspirin or Tylenol for a cat can be very deadly. So you need to be very, very careful. Cats are not small dogs. And just because an aspirin in the dog's okay or a Tylenol in the dog is okay, actually acetaminophen, the active ingredient of Tylenol, acetaminophen will kill a cat. One tablet will kill him unless you really get him to emergency, and even then. So it's a very dangerous drug in the cat. So for cats, we are using actually most of the narcotics. They seem to be relatively safe when used properly. But the cats also respond really well to chiropractic and glucosamine and these alternatives that we'll talk about.
Cats love to be stroked, so. I mean, you know, from kittens, you stroke them, and you really stroke the entire cat, really. You don't really scratch it just around the ears.
Right.
And isn't that a big part of allowing, of a dog rather, allowing a vet to actually stroke it and work with the body?
Well, see, veterinarians are already trained to deal with their hands. A lot of what we do is, since we can't communicate with the animal, it's the other senses, the vision, the smell, and the sense of touch. So for me, to go into an alternative therapy such as acupuncture, chiropractic, was probably a little easier than maybe a human physician trying to transmit from that because of the communication and the touch sensations that we have with our animals. So yes, they're used to being petted, but there's a classic example, and I'm sure some of your viewers have cats that won't let you pet them anymore over the low back. And
Right.
we used to just think, well, he just doesn't like it, or he's mad, or doesn't want to be brushed anymore. And we found a significant number of these cats actually have back pain and respond wonderfully to chiropractic. And it's they hide their pain really well. And sometimes you'll see cats that'll lick themselves over the back, and you look and you don't find any sores or any scabs or any fleas. And you say, well, why, doctor, why is the cat itching or scratching, licking here? And we used to generally say, well, it must be an allergy, it must be this, must be that. So you'd give them a shot of steroids or pain medicine, and it would go away, but it would come back. And what we found again is a lot of these are actually pain. And of course, a pain medicine or a steroid shot's going to take that down, relieve the symptoms, but it comes back. And we find with some routine chiropractic care, not only does the pain fade away, but people constantly remark to me that, gee, now I can pet him back there, now I can brush him back there. Gee, now he's stretching out again.
Right,
He
right.
wasn't doing that for a long time. And cats especially hide their pain really well. Dogs are still, they're very good at hiding it too, but cats are extremely good. And we've seen a lot of conditions in cats that are actually pain related and respond very well to chiropractic.
Well, I find with him, if he's having an off day, and what animal doesn't have an off day over a period of time? He will just kind of go behind the bed and curl up. And when he curls up in a little ball like that, I think that, you know, he's got tummy ache, something's going on with him.
Well, that's nature's way. You and I try to find a pill, or we try to go to work instead of taking the time off.
Right.
Of course, the dog doesn't have to go to work, so he can do that. But that's nature's way, and it does usually mean there's something up.
And usually when they work it out and all of a sudden they get up, stretch, jump, and they're fine.
Yeah.
They've dealt with it. I don't know, after surveying animals, and I'm sure you must have come to the same conclusion. I think they have a different pain sense than we do. It's not that they don't have the same pain, or maybe the same intensity, but it doesn't get to them as fast as it does to us. They have a different tolerance.
Well, I think they have different tolerances. We'll often see dogs come in with broken teeth, and the owners have no idea that the tooth has been broken. You know, if you and I break a tooth, you know it. So I think that's Mother Nature's way of helping the animals cope with being out in the wild and survival. But I think in the other sense, then they really have to be relatively painful to show us a sign. And the other thing is that we are not 100% versed in how a dog shows pain. Certainly, if there's a broken leg, you know it, they know it, everybody knows it. But the chronic pains that come with aging and arthritis, because they've been building so long and so subtle, these animals learn to live with it just like you and I live with aches and pains.
Maybe our friend has settled down a little bit, and we can.
Well, there are many different forms of chiropractic, and the form that we use on the animals, you can adjust them with your hands. There are different schools of human chiropractic, and the technique we use involves what's called an activator. This is a human chiropractic activator tool. I know we can get this in. And basically what it does, you can dial this up and down for more or less force. So actually this one tool could do a 3-pound kitten and a 3,000-pound horse by dialing the different strengths in it. Well, what we'll do, we'll go down and we'll adjust him and we'll let him go since he's so nervous. And then we'll explain what we're doing using the model. So basically the principle is we feel on the one hand, we'll feel the vertebrae here, and we can go down. You can find areas where he's going to flinch for you. Now, dogs and horses have reflexes that people don't have. So if a fly lands on their skin, they can flick their skin like that. So what happens when we're finding areas of pain, you'll get that. See right there, and see him flinch real hard? So he's actually got some pain right here in this muscle area. Now if you can just hold him still, we'll see if we can trigger that reflex. So what we're looking for when we adjust him.
Okay, it's okay. It's okay.
Hey, buddy.
It's okay.
Hey, buddy.
Yes. Oh, nothing like being live on television.
Yeah, he's being a little tough today.
But you know what it is? This is a challenge. Think of it as a challenge.
There we go. Well, he's never been adjusted before. Now you can see him really flinch and turn there. So these are areas that not only the instrument will then treat, but it'll also pick up and diagnose where the problems are.
You managed to get some of it in, though.
Right.
Yeah.
Well, what we can do is use the model to demonstrate what exactly it is we're doing. So
now I know that's a vertebrae.
This is a plastic model of a vertebrae. This would probably be a smaller dog than Duffy, but so the spinal cord runs inside in a tube protected by all these bones. And so when we're feeling the dog, what I'm doing is coming down with my hands this way. And so what can happen if, let's just say, I'm going to exaggerate this for the purposes, but if I'm coming this way and all of a sudden this one's over here, then I can tell, boy, we have a problem at this area.
Right.
Now, you can imagine if this is tilted over here, that's going to cause a pinching of the nerves. The yellow is the nerve here, and the red being the disc. So if you have what's called a listing in chiropractic term, so just like a ship would list to one side, okay, and again we'll exaggerate this, then we could see very easily that the nerve would be pinched or the disc would be pinched. This is going to cause pain, muscle spasm. It may cause loss of feeling in a leg, so we may have an animal that's dragging a leg. Certainly can also cause pain. And if there's enough pressure here, the dog's not going to want to move. And so what we do as we're coming down here this way, now we feel this, what we're trying to do then is actually direct this pulse this way so that when we do this, this brings this back in alignment.
That makes sense.
Right? Now, you can have vertebrae that are going to be tipped forward, they're going to be tipped back.
Right.
So we can feel all that as we're going along here. Now alongside of this are the great big muscle cords of the back which help the dog and the cat in their four-legged gait as they kind of spring. So if this nerve is all irritated, of course that puts the muscle into spasm, and so we're going to feel that. you might want to call it a muscle knot like we all get.
Right.
We can then pulse this into the muscle here as well, which is what I was doing a little bit on Duffy. I came down, I found those sore spots. We went right down the spine, and then when I came over here, he actually twisted his body right around because this muscle was in such spasm that when I stimulated a pressure and a pulse in here, it stimulates the nerve, it travels into the spinal cord, comes right back out and stimulates that muscle to relax.
Now, there's no discomfort in that outside the fact that he had some anxiety, right?
Right, there's none whatsoever. This is not about force. In fact, if you put your hand out,
No, you don't.
see, there's
Yeah,
really
right.
nothing there at all. It's not about twisting and pushing. It's about stimulating the nerves. And that's why this method of chiropractic is different from other ones.
From where they...
Right. So you can also see if I did my hands this way, not only, so let's make our exaggerated turn here, I'm actually holding 5 or 6 of these vertebrae. So I might get this and I might not as I push. Now the other thing is, animals don't like you pushing on them. Us humans put up with it because we know that's what's going on.
Right.
You try to do that to an animal's in pain, they're going to holler.
Right, right.
Because now I am pushing on the muscle, I am pushing on those bones. Whereas if I do this, I'm really not.
Now, I never would have thought that Duff had any discomfort at all before you did it. I mean, he's never shown it. He still jumps pretty much the same way he did.
Right.
Not as high as when he was 4 years old, but...
Well, and this was the conversation we were having about animals hiding their pain well. We chalk it off to, well, he's old.
It sets me wondering now, you know, just where is he?
And oftentimes we set it up to, well, he's old. I don't expect him to go run and jump anymore. And oftentimes it's because they're in pain. And the pain has come so gradually, so slowly, that muscle's been locked for maybe weeks, maybe months. And then the amazing thing is after a few treatments, you release a lot of this. Oftentimes people come in and tell me, wow, you know, he's running, he's jumping, he's playing, he looks like a puppy again. Well, they're in pain. There's a lot more pain out there in animals than we're aware of, even as veterinarians. Because the animals come in, we say to you, how's he doing? It's just what you just said to me. Oh, he runs, he's moving around, he looks good. He's not limping, no. You touch him, does he hurt? No. But he's in pain. And that's the nice thing, too, about alternative medicine and using this technique because of that reflex. When I do this, I'm going to hit that nerve reflex, and that reflex, if there's pain there, if the nerve is damaged there or compromised, that's going to trigger that reflex, and I'm going to see it. So we actually diagnose that way. Then I know where to treat. I'm going to treat him on this vertebrae versus that one. Okay? We do adjust the whole spine, but I know that this vertebrae is the problem. Then also, if I have a dog that's having some paralysis problems, I also know this is right where I want to take my x-ray. This is where we want to see. We also know that we can then do acupuncture around those same areas. So am I going to do acupuncture on the whole spine, or does it make more sense if I could find the spot to do the acupuncture there? So obviously it makes more sense to do the acupuncture in the areas where we're having trouble. So then we take our little acupuncture needles, and these are very tiny, probably can't even see that on the camera, and they go into the acupuncture sites sitting here. So we might end up with a little needle sitting alongside the spine in an area, and we twirl them, and there are different acupuncture techniques. And now we know from this device that this is where I want to go.
Do you have to sedate the dog to be able to put little needles in him, though, and twirl them?
No, not at all.
I just wondered, because from what we just saw with Duff before, and he's a very, literally, he's really an easygoing dog. And I'm just thinking, while you were doing that, would he really sit for that?
Yeah, most of them do, unless they're in a lot of pain. Now, he's more nervous than painful.
Right.
Coming in the veterinarian's office, a lot of them are nervous. So if that's the case, oftentimes then we'll use some Bach flowers remedies, for example, to calm them down. We'll use some herbals ahead of time. If this is a dog that's always upset when he comes in, we'll give you some herbs to give him a couple hours before he comes in. Or We give him a tranquilizer pill if we have to, if he's that nervous. But the majority of them, no, they're fine. And after, especially the dogs, after 3 or 4 treatments, they come to associate this little clicking thing, this noise.
Right.
They come to associate this with, I feel better. And most of my big dogs now, they run in and they jump on the table. It's phenomenal. They just want to get their adjustment because they know they're going to feel better. So they're real smart, and they understand what helps them and what doesn't. So majority of them, especially after a few times, and they're loving it.
Well, what are the rest of these things? I find it absolutely fascinating. Do you ever find that you ever have to do surgery?
Well, sure. On occasion, there are things that have to be surgically fixed. If you have a ruptured disc and a paralysis that's putting pressure on the spine, the dog's paralyzed, sometimes you have to do surgery. If you have a knee ligament that's torn, all the alternative medicine in the world isn't going to fix that. You've got to surgically go in and fix it. The difference then comes in the rehab. So, for example, if we have a dog that's had surgery on the knee, just like a human who's had surgery on the knee, it's well accepted that the human should go through rehab. Well, there's nothing like that for dogs. There's beginnings of things like that now starting for dogs. Water treadmills, that kind of thing. But we find that the chiropractic and the acupuncture is very helpful to these dogs post-surgically as well, because if this dog, again, being four-legged, let's just say he's carrying this knee because it hurts, now what's that going to do to his spine? It's going to twist his pelvis, twist his spine, just like us, and we're going to have other problems. So in rehab, it's actually very helpful as well.
What are these?
Well, these are various alternative therapies that we use in conjunction with the chiropractic and the acupuncture. So supplements such as glucosamine, chondroitin, antioxidants, these kinds of things. The reason I brought these is not only to demonstrate them, but also to talk about what's going on out there in the world, because there's very little regulation at all in the supplement industry for humans, and there's even less for dogs. Now, ironically, for dogs, because these are mostly private companies, there are some of these companies have actually put their own stuff through clinical trials. Probably the most common and the most famous one is Cosequin. This is a combination of glucosamine and chondroitin. So the two issues here are one of purity and one of quantity. Consumer Reports did a big thing about 1.5 years ago where they went into like GNC and CVS and they pulled all these glucosamines off the shelf and they tested them. They found 87% had minute traces of glucosamine in them, and of the other 13%, only 3 or 4% had actual therapeutic levels. So the point is that you and I could make a glucosamine, put it on the shelf, it doesn't mean it has to work. There's no regulation whatsoever. So, you can buy a glucosamine for $5 a roomful. Trust me, it's not going to work. This little bottle will run you probably about $80 or $90, but it works. And if we're talking about our animal who's having a problem, you want something that works.
Well, it's true, because I was pricing it. My vet had said to me to get that for Duff. Glucosamine and chondroitin. Chondroitin. And I was pricing it, and I really wouldn't care what it costs as long as it works. But there's such a fluctuation in product prices no matter where you look. And I'm thinking, I don't really know that much about this.
Correct.
Which do you go for? You know?
Well, you have to trust your veterinarian on that. In good glucosamine, you're going to get what you pay for. Its quality, its purity, its bioavailability. None of these issues have been addressed by the FDA in supplements. This is a company that's actually gone through and done the tests. The other thing that we want to find is very helpful is antioxidants. Antioxidants are the body and the nature's anti-inflammatory, where glucosamine chondroitins are more of an indirect anti-inflammatory because they initiate repair. They initiate new fluid being made. You have to have fluid in your joints just like oil in your car, so everything is nice and smooth. So the combination, using this more for direct pain and this for the indirect pain long term, this is a combination that works very well.
You know what? I'm getting time signals here, and believe it or not, and I can't believe it, we're down to 2 minutes. So, in the last 2 minutes remaining, Mark, What would you tell people with their dogs or their cats, or what to possibly look for to get them to someone for alternative help?
Well, I think the big changes that we see are the changes that we see are very subtle. They're not big changes, I should say. The dog doesn't want to go up the steps anymore or goes up hesitantly. Maybe the dog runs fine. This is the dog that kind of takes his good old time getting up in the morning. And we chalk that off to old age. And it may or may not be. In most of the cases, it's not. The cat that won't let you pet them down the back. The cat that tries to jump to the countertop and misses. Not every time, but misses and falls. This is a cat that's got pain in his back and can't do that springing up. Animals that have behavior changes. They're in the corner more than not, or you go to try to get them out of the corner, maybe they're very hesitant, or maybe they even growl at you. These are signs, subtle signs that we humans need to read to think that our animals, there's something wrong with them, and more often than not, as I see in my practice, it's pain. The other place to seek alternative help is when your animals are semi-paralyzed or having trouble moving their feet around. Unfortunately, in traditional medicine, all you have is steroids, and we all know that's no good.
Right.
So we see lots of those patients coming in for second opinions, and can I get them off these steroids, and what else can we do?
Well, Mark, it's been wonderful having you back. You come such a great distance. I really think, and I shall talk to the crew about this, especially Cindy, perhaps in the summertime, we should come down and see you in Margate.
Well, we could do that.
Doesn't that sound like a great idea?
Sure.
Mm-hmm. It certainly does, Cindy. I hope all of you out there had as informative and interesting and entertaining time as I had today. I become completely wrapped up when I have Dr. Newkirk here, and I hate to leave him, but I do. So I'll see you all next month, and in the meantime, take care.